good?
Yep. Hang up one sec. Right, the studies get ready. Good. First of all, just give a name and title, please.
I'm Associate Professor Adriaan, and I'm a respiratory physician at the Wagga Base Hospital and in private practice in Wagga.
Alright, so what are we preparing for?
What are we preparing for? Well, this time of the year is the time when the pollen starts to come out, and we have to be aware that people who have uncontrolled asthma are in danger of having exacerbations of their asthma. So I think over the years a lot of emphasis has been put on springtime as a time when people should be running for Ventolin or reliever medication. And we were just having a discussion with some of our colleagues just a few minutes ago where I tried to emphasize that the key issue is not to be saying where is my reliever, but to try and make sure that your asthma needs to be well controlled. And well controlled means you need to be on a preventer medication. So a lot of people who get diagnosed with asthma are not necessarily compliant with their preventer medication, and then they get into trouble in this time of the year when there's high pollen loads, and especially with the thunderstorm season approaching, we have an extra burden of pollen and antigens that gets into the air, which then also results in exacerbation of the asthma. Now we know from previous experience that those people who exacerbate are normally the ones who are non-compliant with their inhaler therapy, their preventive therapy, that is. So we want to emphasize that it's very, very important, if you have a diagnosis of asthma, that you use your preventer medication and that you are compliant throughout the season. It is also possible that there are people who have not been diagnosed with asthma who start to realize they have symptoms for the first time during this time period. So that is important then that they get themselves diagnosed and get onto preventative treatment. The reliever treatment is good. It's good for relieving the symptoms, but one can view it as a band-aid. Another way that I like to refer to it is that the reliever treatment is like an Alsatian, it's like a watchdog. It's alerting you to the fact that there's a problem. What you need is you need to get rid of the intruders, and the intruders are the inflammation in the chest, and that's where the preventer medication is useful. And that's kind of the message that we would like to get out there for people to understand.
Why is the Riverina such an area that has, I guess, the thunderstorms that trigger asthma compared to other areas? Why is that really good in the Riverina?
It's an interesting historical question. It's an interesting historical question. The reason why the Riverina is prominent is because we had a big thunderstorm epidemic in 1997, and during that fateful night in October of 1997, I think it was the 30th and 31st of October, about 300 cases arrived at Wagga Base Hospital, and the hospital was totally overwhelmed. Now subsequently we've had smaller outbreaks in the springtime, but after that event, the event was captured by a number of colleagues and written up in international journals, and Wagga became known as the asthma capital of Australia. But that's in fact not true. Australia is the asthma capital of the world. The entire island is important for asthma. So it's just in Wagga we put a lot of emphasis on it. During this time there's a lot more pollen in the air, and a lot of people come to Wagga for various reasons. We have young military recruits that come to Wagga, and a lot of these guys start to experience bad asthma in this time period for the first time, and their diagnosis then gets made. But I think it's important to recognize that it's an Australia-wide problem, but in Wagga I think we take particular care of it, and we like to alert people of the fact that it's an issue during springtime.
Do you think all this pollen could be, an extra COVID risk with people sneezing or touching their face?
I think it can be an extra COVID risk. We have one of our experts here, Dr. Gilbey, who is our infectious diseases expert at the hospital, and we brought him along specifically for the COVID questions. but yes, it is a risk. But maybe you can ask him that question in a moment when he's up.
Does the Riverina have a higher number of cases of asthma than the rest of Australia, and do we have more asthma deaths than other parts of Australia?
No, we don't. I think we are pretty much on par with the rest of Australia. But as I said, the awareness in Wagga is higher, and it probably started in 1997 when we had those that thunderstorm event. And since then, this program, which was initiated by the respiratory services in Wagga, led by Robin Payton, one of our CNCs, people have been made aware of this issue in springtime. So I think we are lucky that we have this program and that we have this media coverage to alert people to these issues during springtime.
Do you think it's been quite a dry few years now? We're seeing quite a lot of rain recently. Do you think that'll mean more pollen in the air, more people suffering from asthma? Like it's quite a particularly bad year we're looking at?
I don't think there will be necessarily more people suffering from asthma. This time of the year is a high pollen time. We have the chaps from Sturt University, so they might tell us a little bit more about the level of pollen exposure this time of the year and what they think. They've been doing the predictions now for 20 years. Yeah, 20 years. So they might be able to answer that question to you a little bit more closely.
What asthma can actually lead to, but can you actually tell us what's the worst case scenario with an asthma attack?
So if you have uncontrolled asthma and you have a really bad asthma attack, the main issue is respiratory failure, and in the worst case scenario, intensive care admission is required, and if the escalated treatment is not successful, then people need to go onto a breathing machine. So in that instance, things can go quite wrong, and these are normally the people who are in danger of dying from asthma. But fortunately, over the last 30 years, our treatment of asthma has improved so much that the mortality of asthma has decreased to less than 1%. So we are in a very good place with the management of asthma, but what we need to do now is to emphasize the necessity for proper treatment so that people get diagnosed and that they are on the treatment to prevent severe events like that. So fortunately, it's not something that happens frequently these days anymore.
Do we have a figure of the number of asthma deaths?
I don't have a number on asthma deaths this year, but I know for a fact that it's less than 1% countrywide, so asthma has not been a big issue this year.
Alright, we might need for Tim. Thanks, Dr.
Pleasure.
Dr. Gilbey, Infectious Diseases Specialist at Biomedical Local Health District.
Could you spell Gilbey as well?
Gilbey.
And just come a little bit closer to the two mics, maybe? That's it, thank you. Excuse me.
Could you just tell us a bit about the work that you do?
Sure. My role is specialty in infectious diseases through the Biomedical Local Health District, which encompasses a broad array of things, but particularly in the current COVID pandemic, it involves giving advice, managing patients, and ensuring that we've got appropriate infrastructure to deal with any potential increasing cases and managing those risks.
And going into spring with more people having more asthma symptoms, do people, even if they think it's just asthma, still need to be getting tested for COVID-19?
Yeah, so certainly, as hopefully we're all aware now, the virus that causes the COVID disease is a respiratory virus, and acute infective respiratory symptoms should warrant testing. Certainly Australia-wide, particularly in New South Wales, we have generally, the New South Wales Health have generally supported a very low threshold to test. Go and get yourself tested if you do have acute respiratory infective symptoms. Not all, particularly with the focus on thunderstorm asthma, springtime asthma, not all acute respiratory symptoms are infective, but there is a low threshold to get that test, certainly.
Are we at risk of having a shortage of ventilators if lots of people need to be on them for their for asthma, and like if we have like a flare after COVID-19, is there going to be enough ventilators? Is that sort of something that we've got to think about?
Broad question. I mean, certainly in terms of surge planning with COVID in mind, there's been quite a deal of work in trying to increase the capacity for breathing support should it come down to that. And we've been lucky in Australia, and it should be said, overall well managed in Australia to mitigate that risk. Okay? Because of that risk, there has been an increase in the availability of ventilators through purchasing orders and through appropriate management of infrastructure. Were you to have a double whammy with a bad, for example, thunderstorm asthma event, then absolutely that would be something that could potentially be challenging and would need to be managed locally, which speaks to the importance of making sure, as Adriaan has spoken about, patrolling the disease process with appropriate preventative therapy to prevent that risk and mitigate that risk.
And do you think it's particularly likely that we're going to have a surge of flow?
I think that's unpredictable. It's as predictable as the weather patterns, which are the main driving factor in springtime asthma, but regardless of the ability to put figures on it, the need to prevent both and manage both of those risk profiles is very clear. So the message is clear regardless, and that's if you have an asthma process, then make sure that you are taking appropriate preventative therapy, which covers both irregular asthma, preventative buffers, but also making sure that you're controlling any allergic rhinitis, hay fever symptoms which we know are associated with, for example, thunderstorm asthma.
Is wearing a mask, is that effective coming out of pollen? People who are sensitive to that kind of thing, as well as staying to
Yeah, so probably not. I don't think there would be a study to answer that question specifically, but the particles that you're breathing in are very small and they're airborne, and so the usual mask wearing won't stop that risk. You could argue that it might reduce the burden and therefore maybe reduce the severity and may be protective, but it won't get rid of it.
Are you expecting more people to, I suppose because the symptoms can sometimes mirror COVID as well, expecting more people to attend or present themselves with either COVID or hay fever symptoms?
Do you mean presenting to hospital?
Yeah.
So, look, in the first instance, anyone who needs to present to hospital because they have severe acute symptoms of any kind should still present to hospital. And I think that's a key message in the COVID kind of era. Early on we were seeing people with very severe problems, heart attacks, etc., not coming to hospital because of fear of COVID-related problems, and that should be discouraged. We know that if you've got symptoms that would normally require you to present to hospital, you should present to hospital. It's very safe, and that can be managed. So that's probably the first thing I'd say to that. With acute thunderstorm asthma or asthma symptoms, the usual protocol should be followed, and that is making sure that you've got an asthma management plan, adhering to that plan, and where the acute management is failing, then escalating further to, for example, GP, and where necessary, presenting to hospital, certainly with less deterioration. With asthma? Absolutely. So, I mean, again, with acute respiratory symptoms, we are strongly encouraging people to get tested. As a nation, it's very important to keep tabs on where the COVID infection has spread to, and so that you can manage that risk profile appropriately. And with you don't know unless you test, and we've seen the problems with some of the countries overseas who have had low testing rates, not getting a good grasp on where the infection is, and therefore managing that not necessarily as well as you'd hope. So get tested early, control your symptoms. I guess the other thing that should be said is if you do have sneezing, symptoms of any kind, allergic or otherwise, it's very highly aerosol generating, and if you were to have both hay fever and COVID infection, for example, there'd be a high potential for transmission in that context. So all of these things are aerosol generating or droplet generating processes, and they should be prevented as much as possible.
Very good. Thank you, team.
Thank you. Dr. Bruce Graham from the School of Biomedical Sciences at Sturt University.
Doctor, could you just spell your name?
Bruce, you've got B-R-U-C-E, Graham, G-R-A-H-A-M.
And your title again, please?
Dr. Bruce Graham. I'm adjunct position at the School of Biomedical Sciences.
Could you tell us a bit about the study?
Yes, we've been involved in monitoring the pollen counts in Wagga for the last 20 years or 23 years now. And as Dr. Bent mentioned, this was triggered because of a serious event we had in Wagga back in 1997 where the outpatients was inundated with people coming in with asthma symptoms. We thought it very difficult in those days to treat because everyone had to be put on a nebuliser. These days we've got a little more finesse with our treatment, but Melbourne had a similar incident 3 years ago, and one of the biggest problems was the fact that the ambulance service couldn't cope with the number of people. So there were several deaths in Melbourne just because the system wasn't set up and people weren't aware of what was happening. And so that's why we try and alert people that this time of the year is particularly serious for asthmatics. It's been identified that pollen in the air, particularly grass pollens, tend to be split up into tiny little granules during thunderstorms, and that makes the particles much more respirable, so they can actually get into the lung rather than getting stuck in the nose and back of the mouth. So people with hay fever tend to get that because they've got irritation in the back of the nose, but the asthma is when it gets down and affects the lung, and in some cases can be life-threatening.
How did this year compare to other years?
Well, so far we've only just started measuring the pollens this week, and we're expecting, because of the great conditions for growth, and people have a look around how green and gold it is around Wagga at the moment, but it's particularly the grass pollens that we're worried about. A lot of people suffer from hay fever and possibly asthma from some of the plants that people grow in their gardens around Wagga, but I guess the biggest issue is the ryegrass that's grown both as a fodder crop and also on the sides of roads where it just grows wild. And I think this year we're going to have a lot more density of pollen granules. Whether we get the thunderstorms is up to someone else to decide.
You've obviously got a wealth of experience as well. Could you, kind of estimate, how much of sort of percentage-wise we're looking at? Is there an increase in, how large that increase will really be?
Well, compared to the last couple of years, I think we're much more likely to get events. In the last few years, we've only had to send out alert messages, which we have a system online where people can register to receive either emails or text messages to alert them that there is a thunderstorm due, and if they're known asthmatics particularly, that they take the appropriate precautions, which may mean try to stay inside as much as possible, avoid going out to exercise just for those few days when the thunderstorm's about.
Bruce, is it practice policy that all the region, given the flying trees and the feeder trees, etc., really exacerbate the amount of asthma?
That hasn't been shown to be the case, but my feeling about it is that if you've got irritation that gives you hay fever and so on, then the airways are probably a little bit more sensitised to it. So it may not be the initial trigger for the asthma, but it may sensitise the airways and therefore make you a little more likely to suffer one of these thunderstorm asthma events if you're an asthmatic.
Has all the summer bushfires and all the smoke that was in the air, has that impacted the rates for asthma?
That I'm not sure. Again, I believe that if you irritate the airways and have inflammation there, whatever the trigger, then if you're prone to asthma, then you're more likely to have an asthma event. But of course, as the others have said, if you're on the appropriate medication regime, then you desensitise and you're less likely to show a serious attack, as they call them.
And it has air pollution in general. We know that, there's lots of cars on the road, lots of bad gases coming out. Is air pollution in general affecting the rates of asthma?
Yes, the same as smoke and pollen granules in the air. Anything that irritates the airway is likely to increase the likelihood of a severe event.
And would you say that the rates have been increasing since the time that you've been doing this study because of air pollution?
Probably not in Wagga. Certainly in Europe it's a major problem with industries over there, but that as a background trigger in Wagga, I don't think we have to suffer from that. We've got pretty clean air here.
How does it compare to a metropolitan centre as well, in terms of, do you see a massive difference in terms of hay fever in a metropolitan area than here?
I really don't have the data on that, so
Definitely looking more questions. Thank you.
okay, thanks folks.
Yes.
Do you want to talk about the app?
Oh, okay, yep. I did mention earlier that we have set up a system to try and alert those who are known asthmatics in the community to receive alerts when there's been high pollen counts and the weather conditions indicate there's a storm approaching. So they're able to register online. I'll give you the details in a moment, and that then allows them to receive either a text message or an email to advise them that they need to be aware that the conditions are such that there's more likely to have asthma. And we run that through the university. If you go online and look for science.csu.edu.au/asthma, that will take you to the page where you can register your phone number or your email address to receive these alerts.
Is this a new app?
No, we've had this going for at least 15 years. It was actually set up by the IT gurus way back before it was typical to be able to get SMS messages sent out from a computer. But of course things have changed. We've got new systems operating out there with this is called the Whisper system that they use for emergency messaging across the university.
And can you just quickly tell us how much of a benefit this is going to be for people who do suffer from asthma?
Well, I think most asthmatics are aware that this is a risky time, but it's just that one extra reminder that the situation could be more severe over the next few days if we're getting thunderstorms.
Wonderful. Thanks, Bruce. That's great. We're just going to hear from Michael O'Reilly now.
Yeah. Okay.
That's all right, Michael.
Yeah, it's fine.
And then we'll wrap up before this is all. Just got something about to happen over here. So.
Mike, did you want to hold the action plan? You mentioned something about the action plan.
Are you on?
No.
Michael O'Reilly, a community pharmacist here in Wagga.
Have you seen a big increase of people coming in to stock up on medication for asthma?
Not yet. We have to be a little bit careful, as Dr. Venter said, that the fact that you can buy a Ventolin over the counter is a bit of a mixed blessing for the treatment of asthma, because the fact that you need to buy a Ventolin in the first place is a bit of a warning sign that perhaps your conditions aren't adequately controlled. You can buy an asthma puffer, what we call a Ventolin, over the counter in a pharmacy. There have been some small changes to the rules around buying Ventolin and puffers because of COVID. So if your pharmacist asks you some questions about supplying those puffers to you, we're doing our job. We have to make sure that there's enough Ventolin to go around. So there are some questions that we'll have to ask you about your history and why you need a puffer. It may seem a little bit onerous, but that's the law. We also are only allowed to sell you one at a time, so please keep that in mind. Pharmacists aren't being difficult. We don't want to refuse anyone the sale of a puffer, but we certainly have rules that we have to follow, so please understand if your pharmacist is asking you questions and is only able to provide you with one inhaler, that's the rules at the moment.
Do you see many people come in for the first time presenting asthma symptoms that have never experienced it before?
Yeah, I think because we have a visiting population here with the university and with the military bases, we get people that haven't been to Wagga before, and the symptoms catch them a little off guard sometimes, because I don't think people always know exactly what they're dealing with. The seasoned asthmatics have a little bit better handle on that, but people that are visiting don't always know what's happening to them. So we certainly encourage them to have a chat to doctors. Remember what I said, that the fact that you need to buy a Ventolin is really is a warning sign for you that even if you're only going to be here for a few months or a few weeks even, that you really need to get seen to.
Have you seen any instances, or are you worried about people panic buying?
Earlier in the year, in March, around the COVID time, March, April, that was certainly an issue. That was addressed, and that's one of the reasons why we can only provide one inhaler at a time. There was pressure on the supply chain in those times. Now that's resolved now, thank goodness. So there are plenty of supplies available. But again, that's back to why we can only provide one, is to preserve that stock so there's plenty of it to go around.
Say someone does come in and they present hay fever symptoms that potentially might have COVID, how do you kind of navigate that as well?
Like most medical businesses, pharmacies are trying their best to stop those people from getting into the pharmacy. So we request that people, if they do have symptoms suggestive of COVID, that they call their medical practitioner or their pharmacist before they arrive and let us assess their symptoms and decide whether it's appropriate that they actually enter the pharmacy. Most of us are set up to be able to manage things from car parks and over the phone. But we certainly would ask people, if you're worried about your symptoms, that you should get a swab. The system for COVID swabbing in Wagga is quite amazing. So we would encourage that before people went into pharmacy.
Say someone does come in, then what's the process then?
Well, all the pharmacists in Wagga and all our staff at the moment are all wearing masks as a precaution. We would deal with that appropriately. All our staff across the pharmacies have been trained on how to deal with that possibility. We would hope that anyone that's sick's not wandering around shopping, but we've certainly got processes in place to deal with that if we have to.
Do you have any concerns that might be the case though? Like, I suppose that's why you're prepared?
No, there's no community transmission in Wagga at the moment, so we have to be prepared. So that's why we're wearing masks and we're closer than 1.5 metres away from people. So we have to be aware of our distancing, but the masks are a precaution.
Alright, I'll be all good up. Thanks everyone. Thanks Michael. Rebecca, was there anybody, I'm not sure if I was reading like something else that maybe probably mentioned to me, or whether I'm imagining it, or whether it's
Just be chatting, guys. Nothing set up.
There is a study.
Yeah.
Kids already gone.
Because I was posted on our Facebook page 4 days ago. But there was a news about it as well.
Yeah. Okay, well,
Because it's a statewide thing.
yeah.
Everywhere.
Oh, Beck, do you mind if I just move this for this gentleman?
Oh, go for it.